So in this lecture series, we're going to examine some of the drugs that can be used for the treatment of migraine. Learning objectives, drug list. And so basically we're looking at 3 or 4 main drug groups, the triptans, the ergot alkaloids, over-the-counter pain relievers, and muscle relaxers. And of course, there's a handful of drugs that can be used for the prophylactic treatment of migraine, some of which we've covered already, others of which we will cover in other cases. And this is a nice summary chart from UpToDate. And actually, I think you've seen this chart, or you will see this chart, if you review some of the pathophysiology material. And so just understand that there's different types of headaches, of course. There's migraine headaches, tension headaches, and cluster headaches. And there's some unique components to these different headaches. And this summary chart is a nice way to kind of differentiate them based on their duration, their symptoms, the characteristics, and so forth. So I'm not going to go into great detail here, just basically remind you that these various headache types exist, but we're really going to focus on the pharmacologic treatment of essentially all of them. So a good place to start is really over the counter. And so as patients develop headaches, and probably many of you have gone to the pharmacy counter yourselves and purchased some of these drugs, first line therapy for any and all headache is over-the-counter pain relievers. And so, and we've touched on some of these. These are obviously COX inhibitors, aspirin, Advil, Tylenol, looking at basically NSAIDs and combination NSAIDs. And so, this kind of brings the age-old question of which one is the best, and it really depends on the individual patient. Some patients prefer Advil or ibuprofen. Some patients prefer Tylenol. Other patients prefer Excedrin. There is a unique side discussion about Excedrin, is that it is formulated with a little bit of caffeine. And so out of all of the over-the-counter pain relievers, Excedrin's kind of claim to fame is that it works really quickly. And that's because of that little bit of caffeine that's added. It increases the absorption within the GI component. Within the GI system. And so whatever drug is co-administered with that, you get kind of a faster absorption because it kind of propels the stomach contents forward. So NSAIDs are kind of the first line kind of to-go therapy for any and all headache. Aspirin and ibuprofen have a much more higher affinity to COX-1, of course, than COX-2. Acetaminophen, remember we said, is not an NSAID, but it does inhibit both COX enzymes. These drugs are very safe. They're given OTC. They've got a very wide therapeutic index. And it seems that the best efficacy of these drugs is when taken early. And so if you know people that get persistent headaches, I'm one of them. If you can take these drugs before the headache occurs, you have a much shorter duration of the headache. And so I have a weird kind of unique migraine that's brought on about by changes in weather. So as the barometer falls, when a storm front moves in, I can feel the migraine coming. And so I just have to kind of watch the Weather Channel here. And I do watch it religiously, and I know when these storm fronts are coming in, and I know I need to kind of start preloading with some NSAIDs. And I already talked about the pharmacokinetic advantage of combining some of these drugs with caffeine. And I may as well spill the beans. If you want to take a drug and you want to get it administered really quickly, and if it's an orally administered drug, you can take it with a little bit of coffee. I have done that to speed up the absorption process of some of these over-the-counter NSAIDs if I'm not taking Excedrin specifically. Excedrin, the brand name Excedrin, is formulated with aspirin, ASA is aspirin, acetaminophen, and a little bit of caffeine. Okay. And so I really like this summary chart because we've been talking about NSAIDs for some time now, and they've got different uses and different efficacies. And what I really like about this chart is that it kind of puts everything into perspective. So aspirin, is a really good moderator of pain. Of course, it'll reduce fever, it'll reduce inflammation, it'll reduce itching. Acetaminophen, of course, we said is not an NSAID, so there's no anti-inflammatory component. It's missing here, but it's a good fever reducer, okay, and it's also a good pain reliever. Ibuprofen, of course, has the added benefit of reducing inflammation that acetaminophen does not. And so sometimes you can see acetaminophen and ibuprofen co-administered every couple of hours away from each other. So it's every 4 hours for acetaminophen and every 4 to 6 hours for ibuprofen. In between those 4-hour doses, you can swap out and you can combine acetaminophen and ibuprofen for really good pain relief. And then just to summarize, I know we've talked about COX-1 and COX-2 enzymes. What I've done here is I just kind of reminded you of some of the more commonly encountered side effects, as well as things that are associated with these drugs. So of course, with the COX-1 specific inhibitors, we're looking at the side effects of ulceration and GI mucosal upset, and we're using them for the patients that have history of STEMI and stroke. And for those COX-2, which are the inducible enzymes, that's kind of our molecular target for pain, headache, fever, arthritis, musculoskeletal pain, and so forth. And so if you go back to all the cases that we've talked about, this is kind of where all of these topics kind of merge. And so this is kind of a nice little quick summary about COX inhibitors. I think this is also a good place to end. So let's stop this video right here. We'll call this introductory to migraine treatment and the beneficial uses of NSAIDs. And so we'll stop there and we'll go forward with the next drug classes.